the process for you? And for anyone listening that's like, oh, this is something that I need for my child or I want to read more about. How do they get access to this? How do you find a doctor that really knows about this? That's like, this is how we got to get into this trial.
Well, first of all, I would, any medical school around you, I would just, go on their website and search stem cells for autism or stem cells for multiple sclerosis or stem cells for whatever disease you have. Type 1 diabetes looks like it's getting, a significant improvement. Rheumatoid arthritis is another one.
Hmm.
So whatever you have, if you have a chronic condition, I would just Google it to see if there's not a trial. Uh, First at the medical school closest to you, and then if not, just on the internet. I'm one of the few, but there are others, out there in the United States as well. And then just see what they have to say.
What could be the negative effects of trying something like this?
The biggest negative is the cost,
Okay.
uh, that it may not help. Uh, because this is still very early, and not all news is good news. And so the first Duke study, which showed a significant benefit, they followed it up with another phase 2 study, which didn't show a benefit.
Hmm.
But that study had some issues. It was done during COVID, and you're not supposed to manipulate your data after you do the study, but they ended up with a significant amount of children with severe intellectual disabilities. And the average autistic child doesn't have a severe intellectual disability. So when they eliminated the children who had IQs in the 60s and below, then kids with IQs in the 70 and above did show a benefit. So that's the only red line we know right now. But as I tell parents, um, we know it's safe. There's no long-term side effects. And it could potentially be beneficial. 65 to 70% of kids benefit significantly.
Mm.
And the biggest question is why not all? And nobody has really studied the non-responders yet. But
Right.
that needs to be done because it may be as simple as they need another dose or they need a higher dose.
Right. Right. Can you talk about your journey a little bit? Like what, at what point in Marston's life did you start to say, okay, let's try some things to see if this works on him? What else did you try before you tried stem cells?
Okay, well, my wife was a bulldog. As soon as we got the diagnosis, she went headstrong into everything, which is why she wrote the book. You don't
Hmm.
even have to read the book. You can just look at the reference section because everything we did is footnoted with websites and phone numbers, what worked, what didn't work, what we think is helpful, what didn't we think was helpful.
Hmm.
She was a dietitian by trade, and so the only thing we knew at that time, was dietary, gluten-free, dairy-free, anti-inflammatory diet. But we did horse therapy, we did hyperbaric oxygen therapy, we did speech therapy, we
Hmm.
did something called floor time, which now has kind of evolved into ABA therapy.
Hmm.
We did all that. And so it was a great combination because she would find the therapy, I would vet it. Does this make sense or
Hmm.
doesn't it make sense? And then she's actually the one that came with me and said, have you ever heard of stem cells? And I go, well, I know what stem cells are, but I don't know if anybody's using them. But then when the Duke study came out, I went back, I found the 2005 article. It all started making sense. I mean, this was not a willy-nilly decision. When they found out that it helped uh, people with brain injury, and they were going to try it on autistic children. Most people don't know there's an animal model for autism. They have bred like autistic rodents and autistic monkeys, and
Oh,
so they gave them human umbilical cord blood, and they got better. And
wow.
so it made sense in theory. It worked in an animal model, and then it went to human trials in a limited study, and it showed significant benefit.
So, what was your experience with it with your son? How long did it take? What did you start to see? What was the process of the whole thing?
Well, as soon as I decided I wanted to do it, I called Duke. They published the study. I went to Duke.
Mm.
I know people there. I can make a phone call and sit down with them and discuss it. And they were the world's nicest people. I had a long phone conversation. But the long and short of it, my child was 23, and nobody had ever done it in an adult with autism. And
Hmm.
so, they weren't sure what to expect, but they were pretty sure that they weren't going to do it.
Mhm.
So then I turned to Panama, which had been doing it for years. And then, Panama, their cutoff was 19. And then I found, or actually my wife found, a name in Chicago, Thomas Loeb. And Thomas Loeb is a world-class pediatric surgeon. He was the chief of surgery for St. Jude's Children's Hospital for decades.
Wow.
And he had a pediatric brain injury study going on at University of Illinois, Chicago. And even though my son wasn't pediatric, nor did he have a brain injury, they could give it out kind of on a compassionate need basis.
Mhm.
And so, I had a long conversation with him, and he just said, if it was my son, I would do it in a heartbeat.
Hmm.
And so I took him up to Chicago. We did it. Uh, and to say it was profound, it was crazy. Uh, you know, at 23 years of age, he might have had 20 words, maybe 30. He could put two words together. And, within days, he was trying to start to talk more. His executive function picked up. He started talking, then he started asking questions, and he started using full sentences. And, we didn't tell anybody we did it. In fact, my niece, she called me on the phone and said, excuse the French, what the fuck's up with Marston? And I go, what's wrong with Marston? Is he okay? She said, no, he just called me on the phone. And she's 1 year older than him and kind of grew up with him.
Mhm.
And that's the first time he ever made a phone call, to my knowledge. He called his cousin and just asked how she was doing.
Wow.
And so then I took him back for a second treatment, and he continued to get even better. And then obviously he wasn't a pediatric, he wasn't a brain injured. And so Thomas Loeb said, let me show you how to do it. And he's the one that really pointed me in the right direction. So then I took over my son's care. And then, my wife said, well, now that you've done this for our son, you have to do it for everyone.
Right.
And I tried to convince her I had a day job. I was a busy plastic surgeon, and, I don't have time for this. And then she said, when you meet your maker, you're going to have to say, so she said, just do it a half a day a week. And so it went from a half a day a week to a full day a week to a day and a half a week to 2 days a week. And, about 2 weeks ago, I stopped operating, and I'm doing this full time. I've operated for 35 years, and we're seeing, once again, you don't want to oversell it because it doesn't work on everybody.
Sure.
But we've seen kids go from just disasters to not disasters, from not being potty trained to being potty trained, executive function. They become lovable. They stop running around. They stop screaming. Kids going from special needs schools to regular schools. Kids that weren't talking start to talk. It's been amazing. And so I want to offer this therapy to anybody who wants it, because I do believe it's the only thing that can change their child's mind on a cellular level.
Hmm.
We know the physiology. We know what these do. It's sad it doesn't work for everybody, but it works for most.
So this is a fascinating story. Let me ask a few questions. So at the point before you had brought Marston in for the treatment, you said he knew maybe 20 words, but was it obvious that he could understand you all and he could comprehend, he just couldn't verbalize anything?
Yeah,
Or
yes. He had some executive function. He could follow, even as a kid, if you said, get your purple pajamas, he would get them, but he
okay,
would never be able to say purple pajamas.
okay.
So his receptive language was much better, obviously much better than his expressive language.
Which is obviously why when he was able to express, he already knew how to form a sentence because he had
Correct,
learned
right,
it.
because it had
Yeah.
been in his mind for 20 years.
Right.
And
Wow.
so, and we see that. That's one of the questions I ask parents, um, because there's not a good IQ test.
Hmm.
So I say, if you say, let's go, does he walk toward the door, or he
Hmm.
grabs his shoes? If you say it's time for bed, does he walk to the bedroom? These are all soft signs that their receptive language is good.
And when you went in for these treatments originally, I mean, I have no experience with this, so I can only imagine, like, is it like getting chemo? You go in, you sit down, you have something injected for a while, and then you feel it a couple days later. Like, what's that process?
Yeah, it's easier than chemo, but It would be like going to get like an IV drip at an IV clinic.
Got it. Okay.
The whole thing takes about an hour. And really the stem cell component takes just a few minutes.
Okay.
And so the natural history of these cells is they get hung up in the liver, lung, and spleen for about 8 days. And then about day 8, day 9, they start to migrate back into the bloodstream. And that's when they start to seek out inflammation. And in the animal models of brain inflammation, all the cells are in the brain by about 2 weeks.
Okay. So
So
when did you start to see the first signs that it was working? How many days later?
I think it was 48 hours.
Wow.
Because these cells have, and there's other cells too, but these cells have two functions: stop inflammation, start new growth.
Okay.
And just starting to decrease the inflammation, makes these kids feel better and act better.
Right. Right. And then how often did you continue to do this? And then I know
I,
you took it over.
yeah, he got a second treatment at about 6 months, and then a third treatment a year from that. And so far, he's had 5 treatments over 6 years. About.
Okay. And where is he at now? What is he like?
He lives on his own, drives a car, has a job, and is completely conversant.
No way.
Right, right. I'll try not to cry,
What?
but if you would have told me that 5 years ago, I would have told you, it would be impossible. Sorry. It's
No,
just
I'm crying. That's amazing.
no, no. I mean, it's crazy. On another note, I had a woman who came in who had a devastating trauma to one of her feet, and multiple operation screws. The foot is deformed. It's red. It hurts. Just terrible pain in her foot, and she wanted stem cells for that. And I said, uh, okay, we can do it. They seek inflammation. I can't promise anything, but I think it has a good chance of helping. And probably just a week ago, she's about 5 weeks out. She called me and said, "Can these improve your eyesight?" And I said, "Yeah, it's been shown that they can work on the eye and especially in glaucoma." And she said, "I sat down at a restaurant last night and for the first time in 3 years I could read the menu." And she said, "If my eyesight gets any better, I'm going to ask my granddaughter back for my car back." And she had given up driving because she couldn't see well enough. And so, like I said, that's kind of the anti-aging thing,
Right.
is that it helps treat glaucoma, your heart, and these areas that are aging. In fact, we have a word for it called inflammaging, like inflammatory,
Hmm.
because as cells start to die off, they do get inflamed.
Hmm.
And so I've seen some amazing stuff.